Hey, good afternoon, everyone. We've got Kristina Rua, the AVP of Care Coordination at the University of Miami Health System, and this month's Oncology Hero. Kristina, welcome and congratulations.
Thanks, Jason. It's an honor. I'm super touched.
Can you tell us a little bit about what you do at the University of Miami and some of the positions that you've had that have led to this point in your career? What have you done before this?
So I've been in oncology my entire nursing career. I started inpatient and then transitioned into GYN oncology, really focused a lot on navigation at that point. Started some support groups, really addressing barriers to care that all of these women that were diagnosed with gynecological cancers had. Got involved in a little bit more community stuff too as well, focusing on those that didn't have access to care and resources, and then joined different institutions focusing truly on navigation too as well. Started some navigation programs at Sarah Cannon, and then joined the University of Miami about a year and a half ago, really focusing on developing the oncology navigation department and really creating a structure through our entire enterprise. We have a large oncology navigation program, and it just kind of spiraled into focusing on care coordination as a system and realizing that a lot of the times what we do in oncology navigation and just oncology overall is really focused on that care coordination and that journey of a patient through their disease process. And we really realized that those were kind of best practices that should be replicated regardless of what the patient's diagnosis was. So I was lucky enough that leadership here thought that there was value in that and created a role where we're focusing on basically taking the best practices of what we've established in oncology throughout a system and expanding that to offer patients that are not diagnosed with similar touch points and care and hand holding and coordination in other disease states. So it's really exciting and kind of innovative in the sense of a healthcare system thinking about care coordination that way.
Yeah, that's remarkable. And, it has to delight you that you saw the value in navigation very early on in your career. But it seems like as an industry, certainly across healthcare organizations in the United States and around the world, people are now really seeing the value of navigation writ large and are making investments. And even the CMS and others are recognizing that and changing their guidelines and reimbursement and things like that. Has to feel good for you to have seen that value early on in the patient's life and now to see people come alongside of you as well.
So I say it's rewarding in two buckets. Obviously, there's what we do for the patients, but as
Right.
nurses, innately we're caregivers and we're caretakers, and we really want to make sure that our patients get that care that they really need. And I think anybody that's a nurse, in essence, has some navigator in them, because it is our focus to make sure that the patient gets what it is that they need and that their care is coordinated. So I think the additional and formal title of nurse navigator is awesome. And
Yeah.
I think that it was a long time coming. I think the fact that we're starting to see the value that not just nurse navigators, but anything navigator, patient navigator, financial navigator, even oncology social workers have in caring for the patients and the outcomes that they have is enormous. And we're lucky that we have backing in, when it comes from payers, from CMS, in realizing that there's truly a worth to each of those roles, and obviously reimbursement being available for a lot of what we're doing is a step in that right direction. So we've started to show that there's clinical outcomes that are improved with navigation, that there's financial ramifications for the institutions. There's a ton of ROI behind them. There's patient satisfaction, physician satisfaction. So I think it's really refreshing to have started in a career many years ago that was challenging because there was a lack of understanding and potential role delineation. But as the years have passed and time has moved on, it's been really nice to see it kind of define itself. And now there are other places in the world that are really starting to catch notice and say, hey, this is a game changer when it comes to healthcare, and we
Yeah.
need to start replicating stuff like that elsewhere. So
If you were to put in a few words, like you've known so many navigators, have led navigators, have built navigation programs, what is that common thread amongst navigators as human beings? What is it that?
it's the heart. It is
Yeah.
the heart, it is the caring, it is the stubborn, pig-headed, I am going to get my patient where they need to be with the resources that they need. There's this determination behind that is innate of any navigator, not just on not just nursing, right? That is gung-ho set in the fact that they are going to get that patient to where they need to be. And we go through fire and brimstone and anything that we need to do, beg, borrow, and steal to get these patients connected with those resources. And I think that ultimately comes from a heart that is one of a kind in anybody that is involved in navigating patients.
Yeah. Well, it's so obvious why you were promoted into the position you're in, and taking that view of navigation and really extending it, having the broader view of care coordination across the entire health system. So congratulations on that. It does beg the question though, because you had said that you'd been in oncology your whole career, I believe, right?
Yes.
Was there someone or some event, what was it that made you want to get into oncology? Because that has to be like a personal
It's
choice.
a
People don't go
calling.
in the, yeah.
Yeah, oncology chooses you. And I tell that to everybody. And particularly, I look at new incoming nurses or people that are going into nursing school that are fixated on what they think that they're going to do. So when I went into nursing school, I was hardcore, I'm going to be a pediatric nurse. And that's literally what I set my heart at. And I said, this is what I'm going to do. And I wasn't budging. And my last clinical rotation, which was a clinical leadership rotation right before I graduated, mostly everybody got positioned in the units where they thought they were going to end up working afterwards, except for me. I got put in an oncology unit and I was not a happy camper. And I remember telling my instructor, you know, I wanted pediatrics. I've been pushing for pediatrics. And her comment was, we have challenges putting people in oncology because it's such a combination of everything, right? It's medical, surgical, it's you've got some ICU, you've got some high acuity care there, you've got then the oncology world, you've got some respiratory, and you just give it a shot. And the timing to me was terrible because my grandmother unfortunately had just passed away from metastatic liver cancer. So there was all of this kind of PTSD, if you will, to what had happened to her when I walked into these patients' rooms. And I went in completely negative, saying, this is going to be terrible. I am going to absolutely despise it. And, if I was a 3-year-old, I probably would have thrown myself down on the floor and had a temper tantrum, but I didn't. So I walked in and had the conversation with a nurse manager that kind of spiraled into, give it a shot. Let's see how it goes. And 6 weeks later, I had really enjoyed it. I had created some relationships with some patients that had been there for some time and said, this is not terrible. I could give this a shot. And the manager said to me, she's like, I don't normally hire new grads, but would you consider coming to work for me?
Wow.
And I said, absolutely, because of course here I was mortified that I wasn't going to get a job, right? And so lo and behold, offers come out and I get a job offer in the oncology unit, in the mother baby unit, and in a pediatric unit. And I die because now at this point I have gotten anything and everything I wanted. And what do I
Yeah.
do? Right. So I'm a woman of my word, and I had told this manager that I would take a job offer from her because she was going out on a limb for me and offering a new grad in oncology position, and I took it and I never looked back. So it was a godsend, and I think again, oncology chooses you. It's not something that people walk in and say, I'm going to select this profession, knowing that it is emotionally taxing, but it's also extremely rewarding. So
Yeah.
that's how it all started.
That's remarkable. I wonder, have you ever thought about going back and just catching up with the woman that put you into the oncology program to begin with, or?
So I have stayed in touch with her. I've stayed in touch with a lot of people that had mentored me through just learning oncology. Actually, one of them who was one of the nurse practitioners that started in GYN oncology with me about probably 20 years ago. We just caught up last week, and it's nice to see, to still have those contacts and those people
Hmm.
that have mentored. And mentorship is something that's really, really big to me, both professionally and personally, because I think the finding that those people that guide you, that inspire you, that are people that you can learn from, is super important career wise,
Agreed.
regardless of what stage of your career you're in, right? So
Yeah.
I'm seasoned, just like I like to say, so I don't call myself old, it's seasoned. Since being a seasoned nurse and administrator, I still have people that I latch on to that have value, that have expertise, at different levels of their job careers or their phases in life, because I think it's important that we can always learn from each other. So mentorship
Yeah.
was huge, but
Well,
yes, I keep in touch with a lot of them.
that's wonderful. Actually, that was going to be one of the questions I wanted to get into was knowing that you've probably had several outstanding mentors. Who's one that has really impacted your life and kind of shaped your thinking on leadership, and that maybe lessons that you've learned from them? Is there one person that comes immediately to mind?
So I actually have two that come to mind. One of them, the one that I mentioned, that nurse practitioner that really taught me a lot of stuff clinically, right? And really focusing on looking at the patient's symptoms and their overall treatment plans and how different nuances could be affecting them, and not treating every single patient the exact same way, because there's, how you accept a drug or feel afterwards is going to be completely different than the way that I feel it.
Right.
So he really focused on the clinical aspect. When it comes to the business aspect, there was actually one of our chief administrative officers that took me under their wing when I came in, having had a history of being a clinician and being a nurse, into more of an administrative kind of service line lead role, and
Hmm.
really taught me, really, I mean, it wasn't a taught. I almost joked that, he threw me into the water and said sink or swim, and then maybe every once in a while would throw me a little life jacket so that I wouldn't drown. But in a way that was very supportive, very encouraging, and taught me the whole part that now I use a lot when it comes to just gap analysis and
Wow.
business planning, strategy, and really focusing on the big pictures of everything, but at the same time making sure that we have strategic movement in place without going completely over the top, right? So that we have
Right.
our initiatives that are focused on right now, focused on, like your 3 to 6 months, and then in your, year or two. So that was huge for me, because I had never had somebody that had taught me that business acumen. And it was really kind of refreshing that somebody at their tail end of their career thought that it was, nice to take in a newbie and take the clinician and teach her business. So
That's that's incredible. The University of Miami has an amazing reputation for patient-centered care. I'm wondering, are there any current initiatives that maybe you're a part of that you're really excited about or proud of, or things that you've seen put in place at the University of Miami that that really speak to innovation?
So I think there's a lot of stuff. There's a lot of stuff that we're doing with AI. We have well over 150 different platforms that are artificial intelligence, from
Wow.
everything from, identifying through diagnostics to incorporating when it comes to the clinical decision making, or even when it comes to things like identifications for clinical trials. So I think that when it comes to innovation in that sense, we're at the front and center. We really like try new things and develop new processes that are going to
Yeah.
improve patient outcomes, right? And I think a lot of it is really truly focused on that care coordination, right? Knowing that in a large matrix system like ours, it is very difficult to connect the inpatient and the outpatient world. And that's really one of the things that we're really focusing on is what is the patient's throughput and their journey
Mm.
through their disease process, regardless of what it is. It doesn't mean that just because you have a cancer diagnosis that they're going to get that extra hand holding. There's patients with cardiovascular disease, with diabetes, with rheumatology issues that also deserve that hand holding and that high touch care.
Mhm.
And I think a lot of institutions are starting to realize that incorporating navigation and care coordination programs in those other disease states is valuable too. So I think that's one of the ways that we're setting best practices now, is really
Mhm.
focusing on expanding those care coordination models outside of the already really well established robust programs of oncology.
It's I think somewhat unfairly, health systems have long had a reputation of being almost like Luddites, like hesitant or to adopt new technology or laggards. I I think if that was ever true, it's not true any longer because health systems like the University of Miami and others are really leaning in and leveraging AI, automation, other advanced technologies, not to displace human beings, but really to augment them. And you must have seen so much over your long seasoned career in healthcare. I mean, it's got to be encouraging that. Well, let me ask you directly: are you seeing attitudes change and people more willing to adopt? You said 150 platforms,
Yes, yes.
so you're seeing there's not as much hesitancy. Is that an
No, I
accurate
think
take?
I think it's education, right? And it's realizing that AI only enhances what we do, that it
Right.
is not a substitute of what the human body can do. And so I
Right.
think when we start looking at different workflows and processes, that it's really important that we incorporate that AI into our workflows and our process and use it as a leverage to expand the reach of what we can do, right? And to really take opportunities of sorting through, for example, hundreds of thousands of pieces of data and having a now something actionable and targetable that before we wouldn't have had, or that would have been extremely manual and time consuming and labor intensive to be able to identify, potential trends. And so I talk a lot about AI at a national level and really focus on the fact that what we can do with it is beneficial, and that incorporating it in our day-to-day workflows really is going to just make us stronger versus be that the replacement of a human.
Yeah.
And I tell this story. So a couple years ago, I was actually giving a talk on AI and really focusing on how great it was in the sense that there was, again, data sorting. It had been able to find trends in different mutations in some urological cancers, and identifying that there was a bucket of people that had a specific genetic mutation that normally you would have imagined hundreds of thousands of gene mutations that are sorted through by the human eye. To be able to find that pattern and that trend potentially could have taken years, where sorting it through AI, it was identified, and now all of a sudden it gave researchers something targetable. So here I was ready to give my presentation to talk about this, to talk about how AI had affected and decreased timeliness to care in cancer patients with platforms and software like what Azra has. And my slide deck disappears. And I'm literally got no slides and I have to wing it. And so here I am, fortunately, because I'm passionate and I knew a lot of the data and I had worked with a lot of the different platforms. And all of a sudden I have nothing and I wing it. And so somebody in the audience, still don't know to this day who they were, reaches out to me via LinkedIn and says, this was really truly what we needed to see, to show
Wow.
that the human brain will always be far superior to what AI can do,
Yeah.
because, and the combination of both, how intense and how powerful they can be. So I think that really kind of shifted my mentality as to, there will always be AI. AI will always be improving, but that human brain will be able to fill and plug in holes that an AI software could not ever do. So,
That is such a cool
yeah,
story.
it was a really cool kind of eye-opening moment. And it was neat that somebody reached out that like I said, still to this day, I don't know who they were. But it was an aha moment of, wow, this is pretty intense and pretty powerful.
I've got two more questions and then a lightning round. I'll go
Okay.
super quick. You've mentored and led countless teams. What advice would you give somewhere out there? There may be a young lady, young man that is watching this. What advice would you give to the next generation of folks that are coming into oncology or into healthcare? Any words of advice that you would give them?
So I think the number one is you've got to love what you do, right? So healthcare is a calling. It is something that if you don't feel it from the very get-go, it's okay to change your mind, right? Don't get stuck in that process. And finding the beauty of healthcare is that you can find multiple different roles. It doesn't just have to be nursing, it could be administrator, it can be in the finance, it can be multiple different things. So don't fixate on one thing. That's number one. Everybody asks me, did I plan my career path? Absolutely not. It's go out on a limb, explore, don't be afraid, don't we make mistakes, be open-minded.
Mm.
I think that was one of the thought processes that I had that was really, I don't know where nursing is going to lead me, and I never expected it to lead me to where it has. And I'm very grateful that it has. So I think that's another one. Another one is, as odd as it sounds and as hokey as it sounds, get involved in those nursing associations.
Mm.
And those have truly propelled my career into a completely different level. It has gotten me exposure, networking. I have contacts and friends and nurse navigators throughout the country, so that if I ever have to connect a patient, at Hopkins, at Penn, at MD Anderson, at any of the other places, because we know patients travel throughout the country looking for healthcare, or even when they relocate or whatnot, it's really nice to have somebody to pick up and say, hey, can you help
Mm.
me? Can you connect
Yeah,
me? Can you guide me? Can you be that warm contact? But that was all from networking and creating those relationships through nursing associations that are at a national level. So I would say, as odd as it sounds, join them, be part of them, engage in them, because you
yeah.
have no idea what they can do for your nursing career.
Uh, On that note, are there a couple that come to mind that you could say, just say specifically so people can look
Yeah,
into
so
them?
for navigation, the Academy of Oncology Nurse and Patient Navigators is huge. What's beautiful about that is that it doesn't just encompass nursing, right? So it's got patient navigators, financial navigators, oncology nurses, and social workers. So it's really nice to have that multidisciplinary team there automatically. And
Yeah.
they have been huge in connecting me with navigators throughout the country and even the world. They're really starting to focus on that. Oncology Nursing Society is great. There's a whole bunch of societies focused on social work. So there's tons of them, and they're not just specific to oncology, right? There's ones that you can look into that are other disease states too. But AONN and ONS have been huge in my career.
That's awesome. And are you going to be speaking anytime soon, anywhere fun?
I am. I actually leave in 14 days to Australia.
What?
Um, so I'm going to be speaking in Australia on oncology navigation. Surprise, surprise. So we'll be there we're extending, doing a couple things. Going to go check out Peter Mac. Going to go talk to some institutions on nursing and just overall nursing career, and then presenting on establishing navigation programs here in the US. Like I mentioned earlier, a lot of other countries are starting to realize that navigation is valuable and important. And Australia has launched an initiative similar to what we have here in the US with Cancer Moonshot, really focusing on funding oncology navigation throughout the country.
That's
And
wonderful.
so we're going to share some best practices over there. So I'm really stoked about that one.
That's great. Final question. You live this in your professional life. You live this in your personal life. You're a part of Gilda's Club, correct? Of like South Florida. Can you tell us a little bit about that organization and why you're a part of it?
So I think of all the things I've done in my career, that's probably one of the proudest or most important to me. And I got involved with Gilda's Club back in 2012 at their center in Miami. It was actually Cancer Support Community Center at that point, and really started focusing and volunteering there. Did a lot of education to cancer patients on symptom management, led some support groups focused on GYN oncology. And in about 2017, unfortunately, a lot of those non-for-profits struggled and they had to shut down their doors. So I shifted a little bit and became more involved in Gilda's Club. Gilda's Club is part of Cancer Support Community Center as well. It was started after Gilda Radner, who died of ovarian cancer. So obviously, as a GYN oncology nurse, that was very near and dear to my heart. And what we do is we offer support to patients in the community so that we can ensure that nobody goes through cancer alone. So we have a big clubhouse where we do all sorts of different things, nutrition courses, yoga, painting, support services. We have care coordination programs there. So a lot of the times, a lot of our navigators will volunteer over there. And we just do some really great stuff. So that to me, in the background, and I'm kind of glad that you called it out, but kind of, normally keep that one in my back pocket. It's what fulfills me at the end of the day, that I can give back to the community and use some of my clinical expertise and my navigation expertise to connect patients with the resources that they need so that they can get through cancer assisted and not alone.
That's amazing. Well, we make a donation on behalf of our oncology heroes each month. So we'll be sure to make a donation to Gilda's House of South Florida, or Gilda's Club of South Florida. So
we can't thank you
wonderful.
enough. And it'll be great. We, the members over there will be eternally grateful. I'll have to send you guys a picture. So.
Oh, that's wonderful. All right, lightning round. One of your favorite music concerts you've ever attended?
Michael Jackson. Twice.
Really?
Yes.
Did you say twice?
I went to two different Michael Jackson concerts. I did the Bad tour and the Thriller tour. Yes.
Okay, good. Did he have the glove on, the sparkly glove? Okay,
of course.
All right, cool. Yeah, I had a Michael Jackson pleather jacket that I got from JCPenney
the red one?
When I was in sixth grade. So that's great. Favorite snack?
Ooh, that's Sour Patches.
Oh, me too.
Yeah.
Love those. Oh, okay. After Australia, what's the next place you want to travel to or speak at, country-wise?
So I come back from Australia, and then I'm speaking in Orlando. I'm going to speak in New Orleans. Where would I like to speak that I haven't? So I was asked to speak in Brazil in September, but it's our Oncology Nursing Society Tri-County, and I happen to be speaking on AI that weekend. So I had to pass up Sao Paulo, which was kind of, it was rough.
That's a heartbreaker.
It was a heartbreaker. I had to pass up speaking about metrics and oncology navigation in Sao Paulo. So ONS people, you owe me big.
All right, that's good. And then two more person you'd like to meet that's living today?
That I'd like to meet that's living today.
Yeah.
That's a good one. I can't say I've really thought about it. I would have to say, I think I want to meet Michelle Obama.
Oh, okay.
Not political, just because she's powerful and she's got this girl power thing going on, and that to me is huge. So yeah, I think that'd be kind of. I think I'd be definitely starstruck if I met her, and I'm normally not shy. But.
Something interesting about yourself that people would be surprised to hear.
I was raised in Spain, and I think you and I were talking about it earlier. I think most people don't know that. They look at me and I'm the good typical American, but no, I speak Spanish with a theta, and was there.
And you speak French.
I do speak French. I do.
Yeah.
Well, because Spanish was not considered a foreign language. So I had to take a different language, and being obviously right next to France, my parents did ship me away on a lot of foreign exchange programs, and France was a hop, jump, and a skip away. It was a really rough childhood.
Oh, it sounds like it.
Brutal.
Well, Kristina Rua, this month's Azra AI's Oncology Hero of the Month. Thank you so much for your time, and we wish you the very best continued success in all that you're doing to impact cancer patients' lives every day at the University of Miami and beyond. So thank you.
Thank you, guys.